In some instances, additional personal protective equipment is necessary to prevent the spread of infection.
For example, standard precautions require that a face mask, protective eyewear, and a gown be worn when there is a risk of blood or other body fluids, secretions or excretions splashing on your face or contaminating your clothing. A type N95 respirator is required when airborne precautions have been ordered, such as for tuberculosis. Always wash your hands before putting on personal protective equipment. Face masks and eyewear protect the mucous membranes of your eyes, nose, and mouth whenever there is a chance that blood, body fluids, secretions, or excretions will splash, splatter, or spray. Some face masks may become ineffective when they get wet. A gown may be used to protect your clothing. Unfold the gown so the opening is at the back. Put your arms into the sleeves of the gown and fit the gown at the neck, making sure that your uniform is covered. Reach behind and fasten the adhesive strip. If the gown has ties, tie a simple shoelace bow. Grasp the edges of the gown and pull to the back. Overlap the edges and roll them together in the back, closing the opening and covering your uniform completely. Tie a bow at the waist or fasten the adhesive strip. Gloves must extend over the cuff of the gown. After using the protective gown, remove your protective gloves and discard them. Unfasten the waist and loosen the gown. Open the neck of the gown. The neck fasteners are considered clean. Remove the gown by rolling it away from yourself into a ball. Roll it with the contaminated portion inside. If the gown was used where special contact precautions have been ordered, it should be discarded inside the room. Then remove the mask. If large amounts of blood or infectious material are on the gown, remove the gown with your gloves on. Remove the gloves after the gown has been disposed of and before removing your mask. Respiratory protection, such as a type N95 respirator, is needed when airborne precautions are required, such as when entering the room of someone with tuberculosis. Face masks only protect against splashes and cannot provide adequate respiratory protection. Make sure the respirator makes a complete seal around the face so that unfiltered air that could be contaminated is kept out. Finally, remember to wash your hands after giving care.